Hi, welcome everybody. It's me, Dr. Khaled Sadek. You're watching my fantastic YouTube channel on cysts and lipoma removal. Welcome to another episode of Fireside Live Chat with me, Dr. Sadek. If you were there on the last episode, you will know that every Wednesdays, Fridays, and Sunday at 9:30 p.m. GMT and 5:30 in the evening Eastern Time, we'll be doing a live chat ahead of a brand new video premiere. So, hope you enjoyed the last couple of videos. I think we've had a bit of a run on pilar cysts over the last week or so. We had two very large prominent cysts at the back of the head. We've got two more coming up. But let me know if you want to see more pilar cysts, or do you want to see some epidermoid cysts or blackheads. Tell me the sequence of videos that you want. If you're new to the channel, welcome. As you know, we specialize in the removal of cysts and lipomas. And if you see anything in the channel that you think, yes, that actually is something that I need, then don't hesitate to contact us at lipomacyst.com, a website dedicated to skincare all over the world. So wherever you are in the world, lipomacyst.com or drkhaledsadek.com. Don't forget to also follow us on Twitter and Instagram. Again, that's Dr. Khaled Sadek. And I've just set up a new Facebook page. Guess what it's called? You got it, Dr. Khaled Sadek. So find that Facebook page and go add yourself. We've got one subscriber. We've got one person that's found us. So come on, we've got 100,000 subscribers on YouTube. Actually, come to think about 100,000 subscribers. I think we all need a moment together just to admire this shiny plaque. So we want to put this away and replace it with the next milestone. So we've got to keep going, we've got to keep pushing. And my 2020 resolution to all of our popaholic community is, we're going to give you the best pops in the world. The best pops. No surgeon, no dermatologist anywhere on YouTube is going to give you the highest quality pops that we have. And to prove that, the next video we've got is a director's cut. So some of you may have seen the video that we're going to be releasing straight after this. You may have already seen it because actually we released a track, so you can listen to us chatting away. We've got a much more. I won't tell you more. You're going to watch it. It's straight after this. It's the special editor's clip. Let me put this back without breaking it like I almost did last time. So I hope everybody is doing well, wherever you are in the world. We'll get to the floor in just a moment. So I hope everybody's well, wherever you are in the world. You're staying safe. You're keeping socially distant. I hope that your countries are coming out of the worst of the pandemic, the worst of the coronavirus pandemic, and that you are able to spend time with your families and live your life normally. I know here in the United Kingdom, we're coming out of a really quite strong lockdown, where we're coming into a stage 3. So it's a 3 out of 5. So that's good, because last week we were a 4, and then the week before that I think we were a 5. Now we're a 3. So we're kind of non-essential shops are opening. So clothing shops and some restaurants are opening as well. So really exciting times. There's also talk of people being able to take a summer holiday. Wouldn't that be good? Take a summer holiday. Something that we took all our lives for granted, having a summer break. Now we all look forward to having a small break in wherever we want to go. So also remember, keep hitting that like button. We've got 50 people watching. We've got 17 likes. We need to hit 30 likes. If we don't get 30 likes, we're not going to release the debut video. There's that video. There we go. Only joking. But okay, so let's take some questions from the audience. Let's go live. Let's have a look. Let's take a look online. Let's see, who do we have? So let's scroll right up to the very top and start saying hello. Let me see if I can bring this camera a little bit closer. There we go. Hope that's not too close for you. There we go, close and personal. So in at number 1 is Lisa Gianturca. She's saying hi. Hello, Lisa. Then we've got J Raw 123 saying hello. Gail Sharp wishing us all a very, very lovely evening. Christiana saying doctor is glowing. Lisa, I'm the first. Yes, Lisa, you're the first. Nana 2AJ Inwa, good day, doctor. Hello. Dr. Sarah, our in-house resident oral surgeon. Dr. Sarah, Perfect Smile. Check her out on YouTube. She'll be taking questions while I'm chatting. So if you've got dental questions, ask Dr. Sarah. Stacy saying camera day. I don't think it's been done on YouTube for Pops. We've got 2 camera setups. And so, yeah, this is going to be a great video. It was a great video the first time. It's a great video the second time. Tracy from Ireland, top of the day to you. Sula Lally, hello from London. Judy saying, hi. L.A. Hensley, good evening. Donna Vega saying, hello. Sharon Newby from Yule, Florida. Lisa is from New York City. Bridget, happy Friday. Bridget's found me on Facebook. You should find me on Facebook. Khaled Sadek page and go like me there. We want to get that page growing as well. Sulu Laddie's from London, fantastic. Grace from Oregon. Oh, Oregon. Gibby's wife from Indiana. Tracy saying any pop will do, fantastic. Jerry Keane saying hello from St. Louis. Sherry saying hello. Lisa Moore, hello Dr. Sadek. Tracy, evening. Sarah, Christina, don't touch the plaque. Yeah, we dropped it last time. Don't drop the plaque. That's from Bridget. Everyone is saying don't drop it. We're not going to drop it actually. But if we do, I think we can just put it back together with glue. It's pretty flexible. Gibby's not on Facebook. Sorry, no worries, Gibby. If you can't find me on Facebook, you can find me on YouTube and Instagram and Twitter and at lipomassist.com. So next up, we've got LA Hensley. You're the best. You're the best. Smith, enjoying our videos. Lisa saying already liked it. Fantastic. 35 likes, 48 people watching. There's 15 people missing. Who are you? New Jersey from Gail. We've got big problem with the plaque. That's Sulali. Everyone is raising their concern about the plaque. Don't worry, guys. It's safe. I won't touch it. I won't touch it. It won't go on the floor. J. Raw, bad rash on her legs and ankles. Skin looks like a leather and it's dark. How to treat it? Ooh, it's a difficult one. It could be a whole host of things. From eczema to allergy to dermatitis. Lorraine just emailed me. She was concerned about some of the videos. So this is actually important to note that YouTube is now classifying some of the videos as 18 plus adult material. Yeah, I don't get it. So what that means is you won't be able to see the video unless you're actually logged in to YouTube through a signed account and you've verified that you're over 18. It's not just my videos, they're doing this to the whole pop community. You know, everyone is getting that 18 plus category because it's pretty. Let's go. Gibby, 6 feet apart. Fantastic. Alessandra Testa says, hello, doctor. Lisa is saying, it would be nice if you were closer to the camera, at least a meter. We know the metrics here too in the United States. Absolutely. So God bless the metric system. Keely Doll saying, hello, how are you? How are you? How are you doing? Mrs. Barrett from Baltimore in Maryland. Gibby's wife saying, hello. Ellen Mumford, when are we going on a cruise ship behind you? When are we going on a cruise? When are we going to cruise with that ship behind me? I don't know. Maybe we can take it to the bath. Maybe take it to, it's made of brass. I think it'll sink, but I like it. I like the idea. A lipoma cruise. Yeah, why don't we do a lipoma cruise? I'll think about it. Maybe we could take a cruise from Southampton to the United States. Yeah, maybe like New York or Florida. Judy says, where are you? I'm over here, Judy. I'm in front of the camera. Jesse Rasmussen from Canada. Crystal saying hi. Bridget found us on Facebook. We've got De Beer from South Africa. Jocelyn saying hello. Any questions? Lisa, camera is now at great distance. You also pronounced my family name wonderful. I wasn't sure if I pronounced it wrong. Hopefully I did. We've got Essex from in town. We've got Colchester. Brilliant. Crystal from Denver, Colorado. We've got Pembroke Pines, Florida. We've got Jean, Florida, and it's raining in Florida. Hope it's all good. Joyce from Michigan. Miss Shaw, Enid Shaw is saying, I've been to other popping videos that use more than one cam. Lies! I will not accept any of it. We're the first. Okay, well, we might not be the first, but we're definitely the best. Kim from Tennessee. You're such a good pimple pop remover. Thank you so much. That's from Nana. Brilliant. Found the like button. Hooray, we found the like button. Well, that's great that Sherry Kern has found the like button because 10 people have not been able to locate the like button. So we need to keep going. Kel Bell, you have to check out Dr. Jen. He has huge cysts, but I'm still the best. Yeah, absolutely. Absolutely. Let's get the whole pimple popping community up there, you know, really, really high up. Jean, It's awesome that you got 100,000 and congratulations on the plaque. Thank you, Donna. If you have a lipoma, when should it be removed? It's a good question. I think the sooner the better, because the bigger they are, so true when it comes to surgical procedures. A lot of us are scared of the doctors, and that's why these videos are so very important. They're not here for entertainment. They're really there to get the word out that these are simple procedures and they can have life-changing results. You know, we've had some really large cysts and lipomas that have caused great disfigurement and distress to our patients, and just through few procedures in 15 minutes, as you've seen on the video, you know, it's changed their lives completely. So if you've got a lipoma, get it checked out. There's no harm. If you've got a cyst, don't leave it until it gets infected. You've seen the videos, you know what's involved. You just have a little chit chat and out it comes. Tracy, Dr. Sarah is messaging her, so brilliant. Kelly is saying, hello, Doc. Who else have we got in the house? We've got, we've got to scroll through. Everyone's just chatting to Dr. Sarah. Alessandra Testa, congratulations on pronouncing my name. Fantastic, it's an absolute pleasure. Jasmine is saying hello. Lisa is saying hi. Let's have a look. Do we have any questions? I think all the questions are for Dr. Sarah. Staz is saying, hi, Dr. Khaled. I know you're not a vet, but you definitely know cats can have acne on their chins and vets don't bother treating it. What would you recommend, popping or leaving the stuff as it is? That's a good question. I think you're right. I'm not a vet. My instinct would be to say to leave it alone. Don't go popping spots on your cats. They might not like it. Don't do that. But there might be some topical creams that the vet might have, some topical antibiotics. Go check that out. That might be quite good. Or maybe some benzyl peroxide, something to dry it out, a drying agent. But you know, don't take my advice. Speak to a veterinarian, a vet surgeon. Sulalali, we love the videos. Sulalali, thank you so much for your support. Dr. Sarah, Bridget, more lipomas, please. I had 12 lipomas and I did it as a dual session with another one of my surgical colleagues. That'll be released soon, so you can see us kind of working around the table in this kind of ballet of surgery, and we take out these 12 lipomas, which is a great result. We've got loads of those coming up. I love the juicy cysts, says Joy. We know what, we've actually, on Sunday, I've got a really large pile of cyst. It goes everywhere. It literally squirts everywhere. So if you like juicy, squirty cysts, and it was actually one of our beloved popaholics who came into clinic to see me, and he was very generous in allowing us to film the surgery, and he's been live with us before, so I'm sure he won't mind me thanking him so much for allowing us to do that. But that'll be out on Sunday. That's 21:30 or 17:30 Eastern time. Okay. So let's crack on, because we want to release that video. So Lisa is saying, okay, the syringe you use normally, the needle is offset. Is there a special name? No, I tend to, unless I have to bend the needle, to leave it as it is. Don't pop the cysts on your cat, is the advice from everybody. What is your advice for aging skin, fine lines and wrinkles? Ooh, I think you've got to make sure it's all moisturized and supple, drink lots of water. You can have a bit of Botox, a good soap. In fact, I'm really thinking about the idea of good soap. Let me know if you've got any experience with good soap. I've got a plan. Alicia is saying, hello from Birmingham in Alabama. Question, when did you find out you wanted to be a dermatologist? That's Alessandra. So Alessandra, I actually trained in OBGYN to begin with. It's a little known fact. OBGYN for 7 years. So that's where I learned all my surgical skills. And then I packed that up and went to do family medicine. And then I carried on my surgical skills in that context. And that's where I do my minor surgery work. So Phil, oh boy, can't wait till Sunday. Yeah, you know what? I think the Sunday video is going to be great. There's going to be a lot of people who are going to enjoy that. So Jen, tea tree oil combats most things, guys. So yeah, so there we go. Maybe you can try that for your skin. LA Hensley, Dr. Sadek, do you ever wish sometimes that you'd get a little cyst on yourself so you could pop it? I didn't say I don't get cysts. You know, everybody gets cysts. You know, it's natural to get a cyst. But I'm I'm a little bit squeamish. I don't think I could pop it myself. Yeah, it's odd that, isn't it? Okay, so Sherry, I want to know the same thing as Keely. What was Keely's question? Remind me. My cat has bad so maybe there's some sort of dermatitis. Even cats can develop allergies. Judy says she's like Facebook. Awesome. The 70 people, go check it out. Dr. Khaled Sadek at the Facebook account. We'll put some videos on there as well. We need to grow that Facebook account. Tracy is talking to Dr. Sarah. Let's scroll down. Why change? I think why change from OBGYN? You know what? Well, that's a whole different episode. Not today, but definitely worth going into. Wow, so many questions. I'm going to just quickly scroll down. Victoria, hi doc. Thanks for all the assists you've shown. I've got 2 open pores on my forehead. I have to fill them every day. Any ideas? I don't know. Send me a photo. I'll take a look. See what we can do. Aloe vera gel is good for your skin and hair. Why not? Okay, let's see who else is in here. Let's go for big questions. Rusty is in the house. She's saying, I have a diagnosis of a hernia that came out between the stomach muscles that normally separate when you're pregnant. Why are they reluctant to fix it? Yes, so these are common. You got the rectus abdominis, these, the 6-pack or 8-pack in my case. Yeah, I got it. Yeah. So anyway, those they part, they weaken, and the rectus sheath, that's the cling film what you see on lamb. That's the sheath that runs behind the muscle. It kind of is not strong enough to hold the gut, and so you get this like the opening of the muscle, and then you get the hernia coming through. Very difficult to treat because you can't put a stitch in the muscle. It just bleeds a lot. So doing some crunches will help strengthen the rectus muscle again and just bring it together. It's typically cosmetic, and so to have major surgery for that isn't really ideal. The one instance where you should obviously get hernias repaired is what we call strangulated hernias. That's right, that's where the blood supply to the bowel becomes constricted because the muscle is kind of pressing it. If you can imagine, the bowel has come through and then there's muscle just crushing it, and the blood supply gets stopped, and therefore the oxygen doesn't get to the bowel, and the bowel basically dies. It becomes what we call ischemic. It's like the bowel is having a heart attack, and when it does that, the tissue dies, becomes necrotic, and it perforates, and all just goes everywhere. So yeah, hernias can be an issue. So right, let's see, one or two more questions. Jen says, I get cysts all the time, had it on my nose, landed me in hospital, called the triangle of death. The others I learned to get rid of myself. Okay, well that's a happy story. Yeah, 8-pack, that's what I got. Sandra is hello from Enfield. Have I met Dr. Sandra Lee? No, I haven't met Dr. Sandra Lee. She is the queen of the pimple pops. But I'm the king. So next up, Kel Bell, she's buffering. Yeah, I have Wi-Fi issues. Okay, so let's break. Time out. We'll do a live chat on Sunday. Join me or be squared. Enjoy the twin cam edit. Till next time, everybody. Bye bye.